Dr. Hans Diehl.
Good morning. Thank you, Dr. Brian Will, for introducing me. I'm delighted to be with you. I was here last year as a listener. I was inspired, and I recognized that this would be just the right group of people to make some time for. You are people of a vision. You're people of a mission. You're people of good judgment. You're people of in the know that recognized that we need to move towards a lifestyle medicine approach where a simple whole food plant-based diet has to become the basis for taking care therapeutically of chronic diseases. Nothing else really works very effectively. There are too many limitations. And so I'm just delighted to be with you in casting a voice and a vote with you towards a new lifestyle medicine approach, because that is the intelligent choice today. This is the responsible choice today. And this is the only sane choice that we can make. Are you agreeing? Thank you. He had it. He did it. And he thought he was cured. But ladies and gentlemen, mechanical approaches to biological problems have their limitations. And no one experienced that more than one of the men that walked the halls of power. 2004, former President Bill Clinton underwent quadruple bypass surgery. He thought he was cured. And then in 2010, with recurring chest pain, he recognized that it was not a cure. He had just received some extra time. And so he underwent double stenting to keep the restenosing artery open. He was shocked. He thought he was cured. He didn't know. And then he said, what shall we do next? And the answer came from some of the best cardiovascular surgeons and cardiologists in the country. As a matter of fact, when the news spread that Clinton had come for a stenting job after 6 years of the bypass, many of us thought, well, the president didn't really make too many lifestyle changes, did he? After all, he was not known to be a paragon of dietary purity, was he? But his cardiologist was right there and protected him and said, this was not the result of his lifestyle or his diet. What we have to remember is that heart disease is a chronic condition. We don't have a cure for this condition, but we have excellent treatments. And that's what we do. We have biologically oriented problems, chronic problems, and we think that mechanical approaches can solve the problem. So we do 400,000 bypass surgeries a year, probably close to $150,000 each, and yet the best and most even-handed estimates are that only 10% of heart attack victims have their life extended after bypass surgery. $150,000, only 10% life extension. Just to give you some idea, about 10% of these grafted vessels close within 1 week. 18% of these grafted vessels close within 6 months. And here's a study that came out recently that suggested that after 12 to 18 months, that's just 1 to 1.5 years, some 40% of these grafted vessels no longer are operative, they're failing. We have to find a better answer. And then, of course, then people say, well, we can do angioplasties or stents. And there again, we have 1 million of these every year in this country. probably paying $25,000 to $45,000 if everything goes well, and yet you just don't settle for one angioplasty. You just don't settle for one stent. People told me, somewhat disrespectfully, of course, they said, a stent is like a Pringle. You never just take one. But the price differential is very significant between a stent and a Pringle. And yet again, we have to recognize when we look at the scientific data, if you take people with heart disease, they have stable angina, and you give them the very best medical treatment, medicines, and then you have another group, and again, they have stable angina, and you give them, again, the best medicines that we have, but this time you add a stenting procedure, there's no difference in the outcome. And it's for that reason that the new guidelines of the American College of Cardiology have now said that stenting is counterindicated for heart disease unless it is used within 24 hours of the heart attack. Are you with me there? This is powerful material here. Well, here's Dr. Patterson, the chief of cardiology at the University of North Carolina. He's commented on Clinton's case, and he said, you know, essentially, when we do stents, when we do bypasses, when we do stents, when we do angioplasties, essentially it's a tune-up for $35,000, for $150,000. We see people who come in like this all the time, every 4 to 5 years, and oftentimes much, much sooner. And of course, then we can take a look at the statin drugs that are very, very popular. This is now for secondary prevention. People that already have heart disease, when they take these medications, the suggestions are here that it can reduce overall all-cause mortality by about 14%. It can reduce the revascularization need to go in there again with the bypass by about 38%, and it can actually help in terms of reducing the fatal and non-fatal heart disease endpoints by about 25%. So this is for secondary prevention. When it comes to primary prevention, we're giving these people all these medications, all these statin drugs. And here is a major review looking at 11 randomly controlled trials. 65,000 people all in all, where they help people to drop their LDL cholesterol from 139 to 98 on the average, and then the article said, but no evidence was found for any benefits of statin use on all-cause mortality in this high-risk primary prevention setting. What shall we do then? Let's talk about that. Let's go a bit deeper. Let's go beyond the mechanical approaches. Let's go beyond the pharmacological approaches. Let's see where we have to really go, and that is we have to go to a lifestyle medicine approach where people become involved with the medical system in taking care of themselves and to actually initiate a self-healing process. Are you with me there? Yeah, thank you. So the question then this morning is coronary heart disease really inevitable in that it progresses? Is that really true? Or can we do something about this? Well, President Clinton finally smelled the coffee. And he began to join the lifestyle medicine movement in going beyond simply treating the symptoms of his coronary heart disease. And of course, he's now committed to attacking the causes of this disease. He has become one of us. And after 2.5 years, we are all deeply in prayer for him that we don't lose our poster child. We don't want him to slip back in bad habits, right? Now, let's take a look. So you look at heart disease. Today, every third death is due to cardiovascular disease, and yet it hasn't always been this way. I saw a book by Sir William Osler, 1928, a textbook, and it said, listen to this, 1928, you can expect 1 heart attack per year in an average hospital in an average-sized town. Things have changed, haven't they? Because now we have 4,000 heart attacks a day, and cardiovascular disease is responsible for almost every third death in our society. Rare 100 years ago, now accepted as the way to go. And here's Professor Eisenberg. He said, medical intervention after the onset of chronic disease. After you've developed it, there's not much we can really do. We are very limited what we can do, medically speaking, in terms of affecting longevity. Let me give you another example of chronic disease. This is diabetes. We have all the medications that we probably want to have and more, and yet you see in the heart the diabetes epidemic rolling over us like a tsunami with dramatic increase. The same thing is true for the American girth, right? It has been pretty stable. But then something happened in 1980 because they had a surplus amount of lumber in Washington, Oregon to build larger chairs. And of course, whenever you have obesity, you have to be concerned about the dramatic increase in diabetes and high blood pressure and heart disease, arthritis. You know, all these chronic diseases are intertwined. They're running in a school. They're running together. You just don't have one problem usually. They come in a school. So we have to take care of the problem in a lifestyle fashion, in a holistic fashion, because if you do, you not only affect one disease, but you affect probably many diseases, if not all diseases, that are chronic in nature. And here you see again, people say, well, we have so much disease because we're getting older. Not really true. It's partly true, but take a look. Even in the young age group of 45 to 64, I used to be in that group, yeah. You see here, over a period of 9 years, a 50% increase in these chronic diseases. Chronic diseases, they're not just happening because we're older. Chronic diseases are happening because we have changed our lifestyle dramatically in the last 30, 40, 50 years. And with that, you have seen a dramatic increase in the amount of money that we spend on medical care. We used to spend 6% of our income in 1960 for medical care. It's now 18%. And America's dropping in the area of nations with regard to longevity patterns. And no one seems to really want to take a look at this. This is it. I mean, you see a dramatic increase in the change from slow foods to fast foods, right? From oats to Oreos, from beans to burgers, from potatoes to potato chips, from corn to Doritos. We've seen a tremendous change in the last 40 years in particular. So much so that the diet composition has shifted dramatically. We used to live on a diet that was largely centered on starch, unrefined starchy foods, corns and beans and potatoes. This has all been shifted now in this direction here because now the potatoes are potato chips, which means high fat content. The corn has shifted to Doritos, which means high fat content. The plant-based protein foods are now animal protein foods, and so you see a significant shift in the consumption of protein. And with this macronutrient change, this is the American diet. Wherever you find this kind of a diet composition, you will always find within 5 years the event and advent and the genesis and the beginning of Western killer diseases. Example, Japan, China, everywhere. And with this macronutrient distribution, you also reflect the micronutrient distribution. Because when you have this kind of a macronutrient distribution, you always find that the fiber content goes down, the cholesterol levels go up, the salt content goes up, the sugar content goes up, and the nutrient density dramatically decreases. To give you some idea of what the American diet has become, now we're consuming about 30 teaspoons of sugar per person per day. People say that's impossible. Not really, when you realize that 1/3 of the sugar is coming from soda pop and some of these goodies here. Yeah, 15 teaspoons, one slice. And we don't want to talk about banana split today. And then you have the refined potato chips. This is just one tube of Pringles, 1,000 calories. Just think, you could have eaten 10 or 11 potatoes. And people come and say, I cannot eat potatoes, they're fattening. Hello? Or people have the idea that liquid calories don't count. So they have a little snack in the afternoon, and right there you have 2,000 calories. That's more than a woman needs for the whole day. And when you ask them in the evening, we do a dietary assessment. What did you have for dinner today? What did you have to eat today? Somehow they always seem to forget those little snacks. 2,000 calories. And so we shouldn't really be so surprised that almost half of all the calories that we consume in our society are processed foods that are basically without any nutritional value. We're overfed and undernourished. Let me share with you something that has really been on my mind quite a bit, and that is this book here, Salt, Sugar, and Fat. This is must reading, because here you begin to understand that most of the processed foods that are being served today and produced are largely produced by a company underwriting them that has the name Philip Morris. Does that mean something to you? These people know something about addictions, nicotine, but they'll know something about creating how to hijack the brain chemistry, because they know exactly how much sugar to use to create this bliss point. That's why you cannot eat just one Oreo. It's impossible, because within nanoseconds, it hits the pleasure center, I need more! And they know exactly, with outstanding research, how much sugar is needed, how much fat is needed at this mouth feel, that feel-good feeling. They know exactly how much salt to add. And we're looking here now, as the introduction says, at a processed food industry that is making a fortune by slowly poisoning an unwitting population. We have just slipped into it without realizing what has happened. It's like the frog that jumps into the water, and the water temperature is gradually heated up, and the frog forgets to jump out and gets cooked alive because it's so gradual. We're totally unaware, but it is there, huge. Just to give you some idea what the processed foods do to us, we are being advised that we shouldn't have more than 2 grams of trans fats, which cause the liver to go into overdrive to produce cholesterol. And yet, when you have your Pillsbury Grands biscuits, you have right there 3.5 grams. When you have a Jolly Time or butter or popcorn, you have 4 grams right there. I mean, think about this, what we're doing to the body. In general, we have underestimated the amount of fat in our diet, and most of that comes now from meats, poultry, and fish, salad oils and shortenings, and dairy products. Let me just go now, as I talked about a little bit the processed foods, talk about the animal products. And they are rich in saturated fat. And again, governmental agencies recommend that we shouldn't have more than 12 to 24 grams of saturated fat a day. I think that's much too much, but let's just take that as a guideline, 12 to 24 grams. And when you have one Cheesecake Factory crispy chicken costco, you have 89 grams of saturated fat. Are you with me? When you have the Chili Baby back ribs, 29 grams of saturated fat. And traditional deliberate guidelines suggest that maybe we could have 12 to 24. We want to see less than that in our program. Just to give you some idea, again, people don't seem to realize that when you have an animal product, it's usually high in fat. And it's, of course, the #1 source of cholesterol. Sirloin steak, that's really 75% fat. That's not a high-protein food. When we talk about animal products, when we talk about that special pepperoni product, we look at those sausages, that's usually 70 to 90% fat. The rest is protein. So we need to redefine our terms. And you see the dramatic increase in the consumption of meat in our society. In a lifetime, an American meat eater processes 12 cows. I mean, from the snout to the tail, everything. And 25 hogs, everything but the oink. And 2,000 some chickens. Something has to give. And this has to process through the intestinal tract to the body system. Here's some of the latest research that looks at carnitine, which is only found in meat, chicken, and fish. And they have now discovered that this can be metabolized by intestinal bacteria, leading to a new product called TMAO. And this is a proatherogenic particle found predominantly in animal products. Now here you see what happened to cheese. Take a look. What do you think happened in 1970? What happened? What happened in 1975? the American public demanded low-fat milk. Do you remember that? We recognized that saturated fat in milk was a contributing factor to cholesterol and to heart disease. So the dairy industry was very compliant, said, no problem, we'll give you 2%, we'll give you 1%, we'll give you blue water. They did. What do you think they did with all the fat they took off? And can you hear that man barking at his wife? Why did you buy, again, this whole fat milk? I don't want to have whole fat milk. I told you I'm off this stuff. Are you trying to kill me? No. Pass the cheeseburger. Are you with me? We have not put things together in a holistic fashion. And cheese today is everywhere. I mean, this is the American diet here. I mean, this is unheard of by world standards. We're spending $350 per week for a family of 4 per week. Some countries do with dollars a week. And so this is then the American diet, where 50% comes from processed foods, 50% of all the calories processed foods, and only 14% of the calories are contributed by fresh fruits, fresh vegetables, whole grains, and legumes, and maybe a few nuts. 14% of the food we eat today in America comes from nature, and these are the products at their very best. Everyone today says we should eat more fruits, vegetables, whole grains, legumes. And of course, you know, we have said that for some time now, and we have known this also, that the major determinants of our killer disease are dietary and lifestyle factors. Why don't we do it? Let's take a look at the coronary arteries. This is, of course, the underlying disease process called atherosclerosis, a narrowing and hardening of the arteries, a progressive disease. Let me give you an idea what it looks like.
We don't have a health crisis in this country. We have a lifestyle crisis in this country for health.
Many patients that you can identify, it's their lifestyle.
Okay.
It's at the root of their problems.
Remember, the first sign of many heart attacks, 40%, the first sign is sudden death. There's not much you can do after that.
I first woke up, so to speak, when I was working on the anesthesia service, learning how to put people to sleep. And I was seeing my patients for the next day's surgery, for coronary artery bypass surgery, in order to bypass clogged arteries in their heart. Because it was late at night, I drew the man's blood test. And when I took the blood to the laboratory and had it processed, I couldn't believe my eyes. Now, normally, this liquid layer floating on top of the blood clot is quite transparent. It's yellow, but quite clear. You can see right through it. The blood in this patient's tube, however, was anything but clear. The serum floating on his clot was thick and greasy white. It looked like glue. In fact, it stuck to the sides of the blood tube when I shook the tube. I went back to the patient. I said, Mr. Phillips, did you eat before you came to the hospital tonight? He said, yes. I said, what did you have? He said, I had a cheeseburger and a milkshake. And when he said that, I realized that what I was looking at in his tube was all the fat in the beef burger, all the butter fat in the cheese, and the butter fat in the ice cream and in the milkshake. And all this fat had oozed out into his blood and actually turned his blood fatty. Well, 30, 40, 50 years of keeping your blood very fatty creates changes in the blood vessels that are very dangerous.
Over the years, arteries can become clogged with fatty material. Then a blood clot can form, blocking the blood flow completely.
If the artery leads to the heart, the lack of oxygen can cause heart muscle to die. That's a heart attack. If the clogged artery leads to the brain, the patient has a stroke.
The next morning, we took Mr. Phillips to the operating room, and I put him to sleep, and the surgeon opened up his chest. And from these arteries, he began pulling out yellow, greasy deposits of fatty material called atherosclerosis.
You just saw the underlying disease process of most of our chronic diseases that relate to the circulatory system. This is a process that's not only affecting the coronary arteries, but all the major arteries of the human system. We also have to recognize that this is not a disease that happens when you're 70 years of age. This is a disease that happens when you are in utero, depending on the mother's nutrition. That's what actually begins. We're born with clean arteries. By the time people in America are 20 years of age, they already have 15, 16, 17, 20% narrowing. That's the exact amount that we found in China, in Chinese farmers that had died at the age of 85. This is not a genetic problem, just like diabetes is not a genetic problem, just like obesity is not a genetic problem by and large. Because to change the genetics in a society will take about 200, 300, 400 years. These diseases have occurred in the last 30, 40, 50, 60, 70 years. Genetics plays a much lesser role than we ever thought of, which is good news because you no longer have to be a fatalist. I'm stuck. I got what my parents gave me. No. As a matter of fact, epigenetics teaches us today that epigenetics, our lifestyle, can override the predisposition that we have towards genetically oriented diseases in many cases. And so by the time people are 50, 60 years of age, they already have 60, 70% narrowing. And this then, of course, expresses itself when it affects the coronary arteries. You have to worry about a heart attack or angina. If it affects the vessels to the brain, you have to worry about cerebral infarction, senility, hearing loss, visual loss. They're all related. When it affects the vessels to the kidney, you have to worry about hypertension, feet, the gangrene, and the male sex organ. Hey, impotence is not a Viagra deficiency. It's a vascular problem that's a food-borne disease to a large extent. Probably 70% of impotence is related to food-borne issues. These diseases are characterized by fatty deposits in the artery, but they're not natural and they're not a necessary component of aging. To give you some idea, let me take you to the famous Framingham study. They found these are the drivers of this disease called atherosclerosis, which expresses itself in different clinical syndromes. And they found that the three big ones are the LDL cholesterol, high blood pressure, and smoking. Three big ones. But then you can also add diabetes, obesity, triglycerides, inactive lifestyle, stress, and perhaps genetics to some extent. And these are the modifiable risk factors. The three big ones. This is a vision test. Help me. Number one, LDL cholesterol. Number two, smoking. Number three, high blood pressure. The closer you go to the center, the more powerful they are in driving this disease, that underlying disease process called atherosclerosis. That creates the inflammatory processes in the system. That has your arteries on fire. This causes the narrowing of the arteries. Just to give you some idea, if you're 35 years of age, you have high cholesterol, you have high blood pressure, you're a smoker, you have diabetes, you didn't pass a treadmill test, you're 35 years of age, the chance that in 6 years of having a heart attack is, when compared to ideal numbers, 140 times more likely to happen at a 35-year-old age level, male. And in our CHIP program, what we do, we try to modify these risk factors, and as you begin to bring them towards a more ideal level, the disease begins to become facilitated to regress. I'll talk about that in just a few minutes. But please note, when you look at this risk arch again from Framingham, what do you think they have in common? Almost all the risk factors, I think it's 1, 2, 3, 4, 5. 5 out of 6, 7, 5 out of 8. This is in a special category now. 5 out of 8 are under the control of our lips. Our lips get us in a lot of trouble. But fortunately, the foods that we eat don't have to be weapons of mass destruction. They can also be our friends on medication, on medicine par excellence. They can give the body a chance to reverse itself, to heal itself, to become repair-oriented. Let me take you to Loma Linda, where I come from. You've heard of the Blue Zone people? You had a large presentation last year when I was here, looking at the Adventist Health Study number 2, one of the most highly esteemed population studies ever done. Let me take you to Loma Linda, to the university, to the medical center there, and the question has always been asked, what are some of the lifestyle factors that apparently enable Adventists to live longer? Now, Ed talked this morning about a long history that this group of people has maintained, starting in Battle Creek in 1865 apparently, and still going stronger than ever. The question has been asked, since these Adventists live a certain lifestyle, they're very homogeneous in their lifestyle. I mean, they don't use alcohol, they don't smoke, they usually go to church once a week, they have a good support structure. They're doing things in a very homogeneous manner, except, here's the point, except Adventists fall into 3 dietary categories. Some of the Adventists are carnivores, some of the Adventists are lacto-vegetarians, and some of the Adventists are pure vegetarians. And so the government comes to us and says, look, maybe you can help us. Since you have very little difference in the other lifestyle aspects among this cohort, we can maybe isolate the effect of the different dietary components. Are you interested in knowing this? Okay, this is probably just a review for you, but let me give you some idea here. This is the Adventist Health Study number 1 that came out some 30 years ago. They found that Adventist meat eaters had 3 times as much coronary artery disease when compared to pure vegetarians. That number was relatively small here, statistically speaking, and so we said, well, maybe we should have a larger group, and so 7 years ago, they began the Adventist Health Study number 2, and here's some of the results. Well, let me go back to number 1 first of all. They also found that Adventists, these are lacto-vegetarians. These are not pure vegetarians. These are not totally plant-based people. These are lacto-ovo-vegetarians, vegetarians plus eggs and dairy. But when they compared the Adventists with Adventist meat eaters, they only had half the amount of high blood pressure, they only had about 2/3 the amount of arthritis, 2/3 the amount of prostate cancer, and half the amount of colon cancer. Wow, that's a big advantage, isn't it? Moving towards a lacto-vegetarian diet. That's a great way to go. Then they came up with the Adventist Health Study number 2. Almost 100,000 people enrolled here in North America, and they found out now that about 10% of these people are vegans, 30% of them are lacto-ovo, 10% are fish eaters, and about 40% are meat eaters. So the question is, would there be a difference in chronic disease outcome? Are you interested in that? Yeah, okay. Everybody was interested in that. We had no idea what the outcome would be. We had some hunches, but we didn't quite know. Here's the data now. If you are an Adventist woman and you're a meat eater, you can expect to weigh about 40 pounds more in North America than an Adventist woman who is a total vegetarian. And if you look at the lacto-vegetarians, you can save about 20 pounds here. So the point that I want to make is if you are a woman and you want to lose weight, move towards the green, right? How about men? Difference here is 30 years. And again, lacto-ovo is about 15 pounds here. So if you want to really lose weight, you're overweight, what is the take-home lesson? Move towards green. Don't use that V word. Some people are not comfortable with that. They go back to the 1970s in Chicago. Remember, be smart. Move towards green. Yeah, plant-based is great. Move towards cholesterol-free. That's another good way to say it, isn't it? Nobody knows what that means, but it sounds good. Now, Then you look at diabetes. These are now the Adventist meat eaters compared with the Adventists that are on a different kind of a dietary regimen. And here are the pure vegetarians. What's the take-home lesson for diabetes? If you want to prevent diabetes, move towards green, yes. Now, what about hypertension? 4 times more in carnivorous Adventists. What's the lesson here? Move towards green. And so we can do the same thing with cholesterol, which I thought I had here, but anyway, cholesterol is 5 times higher that needs to be treated in Adventist meat eaters than in Adventist pure vegetarians. I had the unique privilege in spending some time with one of the truly great men in medicine, Dr. Dennis Burkitt. He was a man that spent some 20 years in Africa as a British educated man. And he said, Hans, in 20 years, I couldn't find the diseases I was trained to treat in London. I couldn't find them in Africa. I said, how did you keep your scalpel from turning rusty? He said, oh, Hans, I just went to the European wing of the African hospitals, and there I had all the disease that I wanted. Genetics? Race? When these people moved from a country of low incidence to a country of high incidence, guess what happened? Race doesn't make that much difference. They adopt the diseases of the new host country that's reflective of the lifestyle there. So, I've tried to make a point that chronic disease, and particularly circulation-related diseases, are preventable. They relate to certain lifestyle issues. Now I want to ask the question, and of course we pointed out from the Adventist Health Study that the further you move towards the green category of diet, the better you're off in general when it comes to different dietary choices, right? Now I want to ask the question, what would happen if we really applied these preventive lifestyle-related strategies to existing coronary disease? I already have heart disease. I'm the president. I'm President Clinton. I already have disease. It's too late for me? No, because I want to show you that we can influence these modern killer diseases even after they have taken root in our system. We can reverse them, and that's my topic, regressing coronary artery disease. And when I talk about reversing heart disease, I don't want to discount the importance of a regular exercise program, of good stress management, of being a nicer person, right? But this morning I want to focus on what I think is the primary issue, and that is the amount of food and the kind of food that we eat in Western society. So, coronary heart disease then. Second question, is there an inevitable progression, or could we possibly move towards regression of this disease? We had the first indications in World War II as the Nazi armies occupied Europe. We found within 1 year, after taking over these countries, occupying these countries, and taking all the livestock away from these people, and these people now had to live on very, very simple foods, monastic discipline. Not much was offered, very few choices, foods grown in their backyards. And within 1 year, you could see a significant drop in the circulatory death rates in these populations. Within 1 year, and the suggestion was, aha, is it possible that we actually began to reverse atherosclerosis within 1 year? And then the question was, let's see what happens if these countries get back on their feet again and they go back to their pre-war diets. What would happen then? If there's a relationship there, then they should go up again. That's exactly what happened here. Within 1 to 2 years, you see the increase again, the return of the circulation-related diseases. We have known from animal studies since 1965 that we can turn on and off this disease. We can take baboons, we can feed them a typical hospital diet. They did this at the University of Chicago. And after 19 months, the baboon died of a massive heart attack. And that's why in the CHIP program, we always tell our people, don't stay in the hospital longer than 19 months. It's a dangerous diet there. On the other hand, we can also take these monkeys and create the disease, and within 2 years, we can reverse the disease process. And people said, well, that's what you can do with animals because you have laid down the plaque very rapidly. It's still very soft, but in humans, it's very hard. It is sort of like petrified wood. You cannot change that. Well, that was a good point. And then came along Dr. Dean Ornish, and he took people in their advanced years with heart disease. He put them on a very, very simple diet, 7% fat, not the usual American 40% fat diet, vegetarian by and large. And he showed that within 1 year, he could demonstrate a regression of the coronary artery plaques in the system. While on the American Heart Association diet, the disease actually progressed in most of these cases. So what we're suggesting then is, if you go to the American Heart Association to maybe prevent the disease, maybe there might be some help to it. It has a value, but when you want to reverse disease, you've got to do more than just using these simple, modest changes that are being offered by the American Heart Association for the general public. I think we have to become more aware that when it comes to regression of disease, we have to be going much, much further. If the diet has shifted so far to this side here, what is today, going a little bit further here towards the Heart Association is not going to make much of a dent. We've got to go further. And the more motivated people are, the more you can help them to understand the disease process. The more they move in this direction, the more likely it is that these disease processes are indeed reversible and regressible. How did Ornish do it? He used a very simple lifestyle-oriented program. He used multiple interventions, stress management. He used some yoga. He used exercise, stop smoking, and of course he used a very, very simple diet, foods as grown by and large. And then you come to Dr. Esselstyn from the Cleveland Clinic. Here you have a physician that single-handedly, I mean, it's amazing, single-handedly, one physician, you know, he takes those 24 coronary patients given up on by the Cleveland Clinic. They said, we cannot do anything anymore. They have had their bypasses, they had their surgical procedures, they're no longer operable, there's nothing we can do. Maybe you can go to Dr. Esselstyn, he has some kind of a carrot, kind of a diet thing, and maybe he can help you. So they come to him, and he says, let me show you what your disease is all about. Most people that have bypass surgery often don't even have a clue what a bypass really is all about. You ask them, how many vessels did you have affected? I don't know. The doctor knows. Do you know what atherosclerosis? Don't have a clue. I mean, we have a responsibility to educate people, especially when you have a bypass that sometimes is absolutely necessary. It can be. It can be life-saving sometimes. But we have a responsibility in the medical profession to provide now the important lifestyle teaching education program that will prevent a second occurrence or push it further into the future, don't we? We cannot just say, well, I'm just a surgeon, I just did my job, it's somebody else's job to do it. We have to integrate the approaches, we have to integrate the services in a hospital, in a system, which is not really happening. But here is a man, single-handedly, he teaches the people, he says, I want you to come every second Friday. I want you to bring your spouse. And I want you to write everything you eat. I mean, he's very rigorous. I mean, no nonsense. I mean, he's a surgeon. It's black or white. You cut or you don't cut. And he's that way too in his education program. You do it or you don't. If you don't want to do it, get out. Well, actually, he's a very, very nice gentleman. Personal friend. But he's very rigorous. And so the people come to him and they have angina pain. They want to live. I mean, and here's a physician that invests himself with his wife and says, look, if you do this, 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 you will have this, this, this coming out. And we can demonstrate that. We do blood tests every 2 weeks, and we will show you how the blood cholesterol will come down, down, down. And once it's down to 150 and less, we have every belief that the disease process will begin to reverse itself. He did that. He began this about 25 years ago, single-handedly, and he reported the results. Let me give you some of the results. Well, you know, he had 24 to start with. 6 dropped down. It's too much. It's more than I can handle. It's all right. But please note, these 18 coronary patients were seen by the Cleveland Clinic over a period of 8 years, and their cholesterol on the average was about 237. During those 8 years, they had 49 cardiovascular events. That means they also had 9 bypasses and stents, and they had 7 heart attacks. So just being in the best cardiovascular care doesn't necessarily mean that you are now avoiding cardiovascular complications. And as you get older, after a heart attack, they become more rapid. Okay? So now they come to Dr. Esselstyn in 1985, and over the next 5 years, the cholesterol's dropped to 137. There is not one cardiovascular event to count on, and he should have had at least perhaps 30, 40, 50, 60 in those 5 years. He continues the program. It stays below the 150. There's not one cardiovascular event taking place. It's absolutely amazing. And you can take a look today and read his book, Prevent and Reverse Heart Disease, where he documents 20 years of follow-up. They're all alive but one. And these people have been given 6 months to live by the Cleveland Clinic. 20 years later, there. People sometimes come in and say, what happened to the other 6 patients that sort of dropped out? Well, first of all, let me show you how you can demonstrate with angiograms how the coronary artery here, which is scantily carrying any blood through it because it's narrowed, here within 2.5 years is wide open without any medical intervention, just a dietary approach. Okay, what about the other 6? Remember, 18 patients followed the program. We're seen by Dr. Esselstyn and his wife every 2 weeks. No cardiovascular events in 12 years in this kind of a study here. 6 dropped out within 18 months, and they developed 13 cardiovascular events. Again, you see there's a powerful cause and effect relationship there. And Dr. Esselstyn has become very, very vocal. You perhaps have heard him speak. And he says the goal of cardiology today has become the relief of pain and unpleasant symptoms in the face of progressive disability and often death from disease. The approach today has become palliative. We have no cure. Remember President Clinton? No cure. Well, we have no cure, but we have good, excellent treatments. Yeah. And he said we must shift the paradigm from interventional palliative cardiology to arrest and reversal therapy. He calls it ART. He said the time is long overdue for legendary work for us as doctors. We can hardly be proud of a drug and interventional therapy that results in death, morbidity, and inordinate expense and disease progression, and that can never halt this foodborne epidemic. And then, of course, he makes a big point that we need to provide education, motivation, and inspiration. That's what we try to do through the CHIP program. We have 30 hours of instruction where we try to have the family involved, where we have the whole community involved. So people meet in groups of 50 or 500 people, and they learn together. And there's a magic when you have people learning together. There's a support structure that kicks in. There's accountability. So what shall we do then if we want to do something about heart disease? How do we regress this disease? Here are some of my final 10 slides. We need to move from the typical American diet composition that you see here towards a more simple diet composition, as you see here. What we need to do is, if we want to move forward in heart health, we have to move backwards in our diet composition. This is PCRM, leaders in the field. I just feel so honored to have PCRM here today and to be on the same stage. This is really special. They have been advocating for years that we need to have a simple plate that's divided between fruits, legumes, grains, and vegetables. Well, actually, yeah, that's right. This has now recently been adopted by the USDA. They say we need to eat more fruits, more vegetables, more grains, and more proteins, and dairy on the side. You know, with a lot of cajoling and pushing from PCRM and others, the USDA finally gave up on this ridiculous food pyramid. Nobody understood that anyway. And so they finally came to this, and we think this is a great move forward. But there are others that are taking issue with it, such as Harvard. They said it's not enough to just have people eat more fruits. It should be really whole fruits. Right? You can eat fruit leather. That's not really the best way to do it, right? Vegetables. And they say it's not enough to tell people eat more grains. I mean, eat more grains. That could be cakes and pies and Krispy Kremes, right? It should be whole grains, right? And they said, when you come to protein, it should be not protein because people think, I have to eat meat and chicken. No, healthy protein. What does that mean? Well, be a little bit more discriminatory, right? It doesn't close the door to animal products, but it says, be a little bit careful here and add more of the lentils and the beans and these kind of proteins, and proteins everywhere in the diet anyway. And please note, Harvard, no milk. No milk. There's no scientific basis for drinking milk to be in good health. If anything, we probably should cut back or eliminate milk if we want to take care of the chronic disease epidemic. And this is then what we are recommending here. We're recommending, as we're trying to approach whole communities, as we approach whole nations, to tell people we want you to become vegans as of tomorrow. It ain't going to happen. The shades come down. You're just those fanatics. Brush them aside. How are you going to get your calcium? How are you going to get your protein? Come on now. What we feel we might want to do, yes, we need to move in this direction as far as we can. When you have a person with heart disease, we got to be over here. When you want to regress heart disease, this is not the time to diminish these products. You have to go all the way. If you try to take care of the community at large, and the motivation is not there yet because there's no disease yet there, we need to help people cutting back on meats, on dairy, on eggs, and processed foods, and perhaps also should be a little bit more careful with alcohol. Are you with me there? And so we see this as a dynamic process that is promoted and facilitated through sound education. And that's what we try to do through video series and through people that are trained to be facilitators of this program. So when we look at the diet, then that would perhaps help us to avoid and to reverse these chronic diseases. I think we have to really break our love affair with a high-fat diet. Instead of 100 grams, perhaps we should get down to the 30, 40 grams. The cholesterol should ideally less than 50, ideally 0. Sugars, we need to really cut back on sugars. We really need to cut back on salt. We need to really, as we eat more foods as grown, the fiber is on the house. You get easily your 35, 40 grams, no problem. And with that, all kinds of wonderful things begin to happen. All kinds of things begin to loosen up. And you are on the move for the first time. And we really want to push more fluid. Let me finish up here with a quick video that you have already seen, perhaps, but maybe for some of you it's new. Which brings us back to where we started with President Clinton.
How do you lose so much weight? The short answer is, I went on essentially a plant-based diet. I live on beans, legumes, vegetables, fruit. I drink a protein supplement every morning. No dairy. I drink almond milk mixed in with fruit and a protein powder. So I get the protein for the day when I start the day out. And it changed my whole metabolism, and I lost 24 pounds. And I got back to basically what I weighed in high school. But I did it for a different reason. I wanted to lose a little weight, but I didn't dream this would happen. I did it because after I had this stent put in, I realized that even though it happens quite often that after you have bypasses, you lose the veins because they're thinner and weaker than arteries. The truth is that they clog up, which means that the cholesterol is still causing buildup in my vein that's part of my bypass. And thank God I could take the stents. I don't want that to happen again. So I did all this research, and I saw that 82% of the people since 1986 who have gone on a plant-based, no dairy, no meat of any kind, no chicken, turkey. I eat very little fish. Once in a while I'll have a little fish, not often. If you can do it, 82% of the people who've done that have begun to heal themselves. Their arterial blockage cleans up. The calcium depositor in their heart breaks up. This movement has been led by a doctor named Esselstyn at the Cleveland Clinic, Dean Ornish, you know, out in California. The doctors Campbell, father and son, who wrote the China study, and a handful of others.
This then, what we would recommend, eat more food, but the best choice that you can make Eat foods as grown. Eat food as it comes to us in nature. And cut back on processed foods. Cut back on animal products, because animal products are the only source of cholesterol in the diet. And also animal products are the highest source of saturated fat, which again drives the cholesterol that the liver produces. In closing, Dr. Esselstyn summarized his concerns very well. Recently he said, stents and bypasses have their place in emergent setting. Folks, you know, if someone has a major heart attack, that's not the time when you say, hey, I got some good broccoli dish for you. No. You get into that surgical suite there. So this emergent setting, but he said, research, however, confirms that their elective application, when it's not really totally necessary, can neither prolong life or protect from a heart attack. In contrast, plant-based nutrition, and when I say plant-based, I would like to juxtapose this with very low-fat diet, okay? Not just any plant-based diet. We got to have a holistic concept here. A plant-based whole food dietary program which treats disease causation can arrest and reverse cardiovascular illness and halt the epidemic. Well, we raised some questions today, didn't we? Is heart disease inevitably progressive? Or can it be halted? Can it possibly be regressed? And I think we have had a little overview today that coronary heart disease, indeed, regression, the reversal of disease, is actually accomplishable. But what we need to do is we need to provide education and motivation and inspiration to people for whom we deeply care. This is not a matter of, I want you to become a vegetarian now. No. This is a matter of the heart. Caring. Soft touch. Being genuinely concerned about the person rather than about our own agenda. That will make all the difference. Thank you so much.